It's good to be here, and I thought I'd start with this picture, which you may not know what this is. I didn't until a few months ago. This is the young lady there is actually a hamadryad, which in Greek mythology there were nymphs, these are sort of demigods, and they were split into different categories, and dryads were tree spirits, and they would actually animate trees and provide them, give them life. And there was even another little subcategory called hamadryads. And in that case, if their tree was to die, they were so closely entwined that they would die too. Hence why the young lady is objecting, although perhaps not as forcefully as I would under the circumstances. But I thought this was a nice metaphor when you're talking about this connection between trees and health. And it also is an important point that although quantifying the benefits of health benefits of trees, the stuff that soulless economists like me is doing, the idea that there's a link between trees and health is not new. It's as old as human history. If you tell an artist or poet that, this isn't news to them. The tree of life metaphor in the Bible, things like this. It's been going on a long time. So it should make some sense that we start to actually be able to quantify that. So, before I start talking about that, why is somebody who's trained as an economist standing up here talking to you about public health? And there's a somewhat circuitous route to this room. About 7 or 8 years ago, my then boss mentioned, because I wasn't doing urban tree research, I was a fire guy. And he said, it's a coming thing. It's going to be important to start quantifying these benefits. And I'm nothing if not shameless opportunist. So I started looking into this literature, and I was like, wow, there's a lot of gaps here. So I started off, my first study, I looked at the effect of trees, or the relationship between trees and house price. And that's fine, that's acceptable behavior for an economist, no problems there. And then, then I started to get into look at the rental market, energy use, crime. Well, still, this is still borderline appropriate, so it's not too bad. But this is where I started to wander off into the weeds a bit, at least as far as my colleagues are concerned. And what really did this for me was a dissonance between my own personal experience with urban trees and what I was doing in my job. And it's interesting, working in urban forestry research, I sit at my computer and tap away, but then I go out and run in the woods, or I have trees outside my house. So, compared to, let's say, you're working on the Ebola virus, when hopefully one's experience is limited to the work sphere, not personal, it's quite interesting. And so that dissonance was kind of giving me this little itch at the back of my head. I was working on things like energy markets, property markets, and I thought, it's not all, that isn't everything, is it? I'm missing something. In fact, I started to suspect I was missing most of it. And that becomes a little worrying from a professional point of view. And to sort of illustrate this dissonance, I'm going to show you a couple of pictures. This is taken in Toledo, Ohio, in 2006. It's a beautiful row of mature ash trees. And any of you from the Midwest or East Coast probably know what's coming next. Emerald ash borer, this is 3 years later. Right, see that sigh? There's a visceral response to that, isn't there? Are you thinking about carbon sequestration when you look at that? Or something? No, it's a visceral response. There's something more profound here. And that's what was getting me. I was like, okay, I'm missing the point here. And so, enough of that. Let's get to actual numbers now. Now, it's great to hear Tony talk about births, because the first study I'm going to do looked at birth outcomes. Why did I do that? Well, I'm a pragmatist, if nothing else, and there's a statutory reporting requirement for births, so you can get reasonably good data. There are also no great diagnosis issues for a lot of birth outcomes. If you're going to look at birth weight, for example, if you saw a trend over time that birth weight is increasing, you're pretty sure that this represents a true underlying change, because baby weighing's pretty straightforward. If you looked at something like autism, for example, it was different. I read something in the paper, it was a year or two ago now, 1 in 88 people, there was autism's on the rise, and 1 in 88 people in this country now have some form of autism spectrum disorder. Does that reflect a true underlying change in autism? Maybe. Are we just diagnosing it more? Do we consider a broad range of conditions? So that gets a little more problematic. And this is not to say that those are not interesting questions. They're just questions that are a little more difficult to answer, so I shied away from them. The other thing is important. I'm doing observational work. I sadly don't get to do experiments. I would, but I probably need, if you think about tree experiments, you need sort of police powers and millions of dollars, and I'd abuse both, but I don't get access. So what you have to do when you're doing observational work is you have to have a plausible story going in. And Tony talked about some of that we have experimental work showing that if you expose people to natural environment, health, blood pressure, heart rate, cortisol goes down. We know stress is an important driver of birth outcomes. So we've got a story going in, and that's really important. And then make this final point. One time I'm going to say this, and I'm going to get physically harmed for saying this. As a man who's never had kids, pregnancy only lasts 9 months. Yeah. Why do I say that? I quickly go on. Well, I had the address where a mother was living when they gave birth. Does that mean that they spent their whole pregnancy there? In some cases, no. But I would argue 9 months is a relatively short time. Most people would spend most or all their time there. Pregnant women don't seem to typically be, wanting to drive a U-Haul across the country. And you compare that, let's say you had the address where somebody had where they lived when they were admitted to hospital for a heart attack. What would that tell you about their exposure to the natural environment over a course of a disease that goes back decades? It will tell you something, but certainly a lot less. So, what are the numbers now? I looked at 5,696 singleton live births in Portland, my hometown, 2006 and 2007. And I looked at 2 adverse birth outcomes. First was small for gestational age, so if you're below the 10th percentile, based on your gestational age and gender, just underweight. So underweight babies, and then preterm, if you were born before 37 weeks. Now, even the most ardent urban tree advocate isn't going to suggest that trees are the only or even the most important driver of birth outcomes. There's a whole lot of other stuff. So we talked about demography is enormously important, race, education, income of both parents. So I looked at that. Previous births, if you had an adverse birth outcome in the past, you're more likely to have one in the future. Type of insurance people had, prenatal care, distance of stuff, good stuff like parks or public transportation, bad stuff like freeways. And then even went down to the characteristics of a house, down to its heating and cooling system. This was, again, a sort of personal experience thing. My sister-in-law had a son about 5 years ago now in September, and watching her suffer through a hot summer pregnant, she did not look like she was enjoying that very much. So even look, maybe a house's air conditioning makes a difference. I looked at crime. Tony talked about that's an important stressor. And only after doing that, I looked at tree cover in 50, 100, and 200-meter buffers around the center of each person's house. So this is, I should say for privacy reasons, these aren't women from the actual study. You have an aerial photograph on the left with the green rectangles of the lot, the red dots just the center. And on the right, we call this classified aerial imagery. This has just been extracted from the photograph on the left. And you have just those sort of salmon-colored buffers, I guess, so the 50-meter buffers. And what I found was that women with more tree canopy within 50 meters of homes were less likely to have underweight babies. There was no influence on preterm births. Now, you may think to yourself, well, this is maybe a statistical oddity, never to be ruled out, or I screwed something up, also never to be ruled out. There's both reasonable explanations. But since this paper was published in 2011, the results have been confirmed by studies in France, Spain, and now here in California. So you're getting fairly consistent results. And, it's a profound thing. Imagine I've got a healthy weight baby in this hand and an underweight baby in this hand. That the difference between the two might be exposure to trees is pretty profound. This is, really getting at basic stuff. Also, it's important to know how, birth outcomes can set you on a health trajectory for life. Clearly, if you have adverse birth outcomes, you're more likely to die or suffer serious health consequences at birth, but that can persist through life. Also, the expenses of this is horrendous. The cost of neonatal intensive care units is truly breathtaking, not to mention horribly traumatizing for the family. So this is an important thing. But despite the consistent results between these 4 studies, they all suffer from the nice trees, nice neighborhood effect. Right? Where are the nicer trees? They're in areas that are whiter, wealthier, better educated. And we know, as Tony was saying, those are very important, if not the most important, drivers of public health. So you try and control for these things. You try and take into account. But you never can be absolutely sure. So this sort of work is a bit anxiety-provoking, if you have any sense. So it's just bothering me again. I'm getting this little tickle at the back of my brain, thinking, how do we get around this? And about 3 years ago now, I was sitting in this just wretched meeting. It was, well, I guess wretched is redundant. It was, it was a meeting, and I was just really a horrible misanthrope. And what I realized was, and this for me passes for a revelation, is that if trees are good for you, killing them should be bad for you. Okay? Well, okay, why is that a revelation? Well, 2 things. One, trees are very tiresome. They take a long time to grow. So it takes a long time to see a change in tree cover. But they can die real quick. Right? So that's a good thing, for me anyway. And invasive pests, which can be really devastating, they obviously have this wonderfully random component to their spread, which is great, and I'll show you in a sec. So what it means is that while the presence of trees may be correlated with education, race, and income, the loss of trees may not be. And that's important. That's a really important thing. And probably the nastiest bug in the last 10 years, the pictures I showed you, is the emerald ash borer. It's killed over 100 million trees in the Midwest and East. And it kills all 22 species of North American ash. Most trees dead in 2 to 5 years or less, as you can see. They can be really brutal. So I'm going to show you a little animation now. It's going to show the spread from 2002 to 2013. Now you're going to see there's an obvious kind of wave-like spread that you'd imagine. But watch the little satellite populations pop up hundreds of miles from the nearest case. So let's see. That should be Detroit. There it goes. This had popped up in Maryland. I'm going to run it through a couple of times, this. And over in Colorado there last year. And then the histogram there just shows the number of people living in counties infected. So there's over 60 million now. So you can see that spread. And that's just pure gold from a statistical point of view. So this is what we call a natural experiment. The birth of epidemiology was cholera. John Snow in London finding that, in fact, drinking sewage was bad for you. And that was a sort of similar experimental design. I know, it's revolutionary. Well, it was at the time. I mean, so what did I do? Well, I looked at mortality. Why looking at mortality? Because there's great data, right? Same as births. And I looked at cardiovascular and lower respiratory mortality, the first and third biggest killers in this country, and also because there's a plausible link. And Tony talked about some of that. Stress, air quality. It's really important to have a story going in. And I looked at county-level mortality from 1990 through 2007 at the time. That was the most recent data you could get. So you have this long running period, and then the trees start to die. And what did I find? Well, I found that emerald ash borer was associated with increased both cardiovascular and lower respiratory mortality. And this effect increased both in size and significance as an infestation progressed, which you would imagine, this makes sense because it takes a while for the trees to die. So you're seeing a kind of dose-response relationship, at least I'm sure the doctors in the room are cringing at that, but in the loosest sense. And also what was interesting is I found a bigger effect in wealthier counties. Why would that be? Well, the nice tree, nice neighborhood effect. Well, the wealthier counties are going to have more better maintained trees, so if they do provide a public health impact, you're going to get a bigger impact when you kill them. So that was interesting. And what I found was, this was, I guess, it was 15 or 18 states, I can't remember. I found an additional 15,000 deaths from cardiovascular disease and 6,000 from lower respiratory disease. So some non-trivial numbers here. Now, if you have any sense or you have a delicate ego, and I'm probably more in the second category, you get results like this, what do? You don't tell anybody. And you sit there in your office and you try and poke holes in them. So better to make a fool of yourself than have somebody else make a fool of you. And so sometimes what we forget is it's really negative results can be as important as positive ones. So I found a relationship between a loss of trees and health outcomes it could plausibly affect. But what about a health outcome they couldn't plausibly affect? There better not be a relationship there. So I looked at accidental death. Beetles are not going to cause car accidents. And I found no relationship. Now, that isn't a control in a formal experimental sense, but it is encouraging that you don't see a relationship where there shouldn't be one and you do where there could be one. Otherwise, you just think you're picking up it's a proxy for something else. Now, the truth be told, I always thought, I was as surprised as anybody by these results. It's a bit of a long shot, I thought, this study. So I didn't want to invest a huge amount of effort in it. So I was looking at county-level mortality because those data are a lot easier to get hold of. But problem with county-level data, you suffer from the possibility of ecological bias or the ecological fallacy. That is, just because the results apply at the county level doesn't mean they apply to the individuals within that particular county. Now, what do we care about counties? No, we care about people, individuals, right? Well, I'm not so much, but you probably care about people, which I don't understand, I at least acknowledge. And so I decided I'd get hold of some individual level data and see if I could replicate these results. And these results are just in the last few weeks, and so they haven't been published yet. The other stuff has. And so I got data from the Women's Health Initiative, which is this big cohort studies, tracked 161,000 women since the mid-90s, and women were sort of 50 to 79 at recruitment. And what did I find? Well, I found, after controlling for all the stuff, and by the way, Tony's absolutely right, you run these models, it's all the demographics. What we have is they have these baseline measures, and really that's what matters. You measure people at baseline, it almost isn't any point following them, because you know what's going to happen. Anyway, what did I find? Well, I found that a woman's risk of having one of three bad things happening, so either bypass surgery, having a heart attack, or dying from cardiovascular disease, increased by 2% for each year of EAB infestation. So you're seeing an increased risk of these bad things happening. So you're seeing consistent results between the two studies, which is always a pleasant surprise. But yeah, so this is pretty profound stuff. Again, people are dying, people are having bypass surgery, and it appears to be loss of trees is a significant risk factor. And again, you saw this dose-response relationship. More as trees die, you're seeing a bigger health impact. And I think these three studies together, for me, what they suggest is that trees quite literally can be a matter of life and death. This isn't my metaphor. I mean, I was looking at birth and death, so it really was a matter of life and death. And if that doesn't matter to you, then probably little does. I also suggest the Greeks may have been onto something with the Hamadryad, that there indeed is that link, and that if the trees die, then we're certainly in trouble. But it's pretty much all I have time for, but I will show you one picture. I should, in good scientific fashion, acknowledge that trees could be bad for you as well. And this is a picture of me last month, possibly falling out of a tree, doing a study in downtown Portland. We're using actually moss from trees as a bioindicator of human health, where we're collecting them we're testing them for heavy metals and a class of compounds called pHs. And so that was what I was willing to do for science there. Anyway, cheers. Thank you very much for your time.